Hi, everyone. Chad Cook here. Welcome to another Shop Talk. Today we have Dr. Seth Peterson, and we'll be talking about his paper titled Continuing Education Courses for Orthopedic and Sports Physical Therapists in the United States Often Lack Supporting Evidence. And they did a review of CEU courses and published this in 2022. And you may have heard about this paper already because it's generated a lot of buzz on Twitter. Seth, welcome. And I was hoping that you'll give us a little bit of background about yourself. I think you're a triple threat. You're a business owner, I think. You dabble in academia, but you also do research.
Yeah. Thanks for the introduction, Chad, and thanks for having me on the Shop Talk. So you're right. That's the first time I've heard anyone call it a triple threat, but I like it. I'm going to start to run with that. I am a full-time clinician at the Motive, so work a little bit over 30 hours a week, and I own that outpatient private practice in Tucson. I have kind of an adjunct faculty role also at AT Still, and quite honestly, that's probably the role that's allowed me to be lucky enough to engage with a lot of the research activity that I have. I've had wonderful mentors through there, like Jody Young, and if I look back, I think, kind of having this interface through that as well with Todd Ellenbecker, who's in Scottsdale and part of the residency program usually at AT Still, kind of allowed me to see what a clinician was like and how they could also do research while treating patients and having a pretty heavy clinical load, which, if you know anything about Todd's clinical load, is ridiculous. So I got to see that modeled through AT Still, and then the amount of resources that I have through that role has been great. So published a few papers through that role. Like I said, had a lot of mentors kind of through the first 9 years of me being a PT, and so that's been great.
Well, I think clinicians make the best researchers because they're so anchored to what is relevant, and I think that's what's really great about this paper. Essentially, you all looked at the information within CEU courses that was readily available and looked at whether or not they matched clinical practice guidelines or systematic reviews. Can you give us just the synopsis and what you found in the paper?
Yeah, so it's interesting because as far as I'm aware of, no profession has subjected their continuing education courses to this, and there are kind of other professions that have a similar model. But what we found, we looked at, and part of the reason that this hasn't been done is that they haven't used these kind of online platforms to administrate course review. And so we were able to do that. Looking through the courses over the year of 2020, we found over half were not supported by guidelines or systematic reviews. And that's pretty much the main, I think, takeaway from the course. But I think there's, you can we broke it down into kind of different topics that were taught, different body regions, so that you can look at that a little bit. And then kind of another thing that we did was break down things that were taught that were contrary to the evidence. And we have that in one of the tables. That's table 3 in the paper, which I think is a pretty eye-opening table.
Yeah, table 3, and I actually have it in front of me, and I hope you don't mind. I'm just gonna, one of the quotes from this: For many therapists, treating low back pain is the #1 issue for their patients. While there are likely to be a myriad of causes for this pain, the biggest factor may be the quadratus lumborum muscle. Why have we wasted our time so long treating all these other things when it's right there in front of us? It's a quadratus lumborum.
It's just the QL. I like that one because it's almost like a stand-up joke. There's that little punchline at the end.
I mean, this is gold. You have multiple quotes from these things. That must have been a blast to have reported.
Yeah, I mean, some of the stuff, it's funny, but it's fun, at the same time, it was sad as well. I mean, I have one that I wrote down for this as well. I mean, treating the subtalar joint can have reflexogenic effects on the C1, C2 spinal segment, a common site of rotational compensation. And that was, of course, a knee course. So,
of course. So this is a super creative paper, and I'd love to hear the backstory. Whose idea was it? Was it born from a visit to the bar? I mean, this is such a great topic. Tell us the backstory.
That's not too far off. So I actually, graduated from my fellowship and decided, at some point in the future, I might want to teach a course, and that would entail me getting it approved. And so I volunteered for the CEU review committee, the course review committee for our state association, and then ended up being the chair of that committee. And pretty early on, I recognized there were a couple of substantial problems with this. It was totally different than peer review. So one of the problems that I ran into is we are one state, Arizona, that has the requirement that it be evidence-based, but that's it. So how do you operationalize evidence-based? And I might be operationalizing it totally different than a different reviewer, and we might be doing it totally different than a different state. And so that was a problem. And then, there are other issues that came up. There's a lot of pressure as a reviewer to approve these courses, because if you reject a course, you usually get an angry email. We've had people threaten litigation. And so we're put in this kind of uncomfortable position where we have to make this decision, and everything is kind of funneling the reviewer to just approve the course and just move on. And Dan Rohn, who moved from Texas to Arizona, and I was talking to him about this, and he's up in the northern end of the state, which, if you know anything about Arizona, that's where Sedona is, which is the land of crystals and vortexes. And he was like, yeah, I'm getting these mailers for PT courses that are teaching things like that, like vortexes and crystals and weird stuff that's been approved by the state association. And we were just talking back and forth and figured out, like, yeah, we could probably get some of this data and take a look at it. And so that's what we did.
That's brilliant. And I imagine that you probably maybe or have taken some bullets from publishing this paper from individuals who may disagree with the findings. How did you anchor, when you say evidence, how did you quantify evidence in the paper so that when you compared what they were saying, it was compared against something that was substantial?
Yeah, that was probably the toughest part of this paper. So what we wanted to do was be very generous, because we knew, obviously we're taking a limited information. We're not sitting in on these courses either. So we don't truly know whether this is the information that was taught or whether it was totally different from what the course description had. But we decided what we wanted to subject these to was just a basic standard, is there any guideline out there at all? Okay, if there's not a guideline, is there any systematic review out there at all? And we kind of, tried to make it simple, because, some of these courses, like the quote that I just mentioned, subtalar mobilization, that's a specific technique. So there's probably not going to be a lot if we're looking at specific techniques, but if we lump that into manual therapy, we could look at that. So similar to how guidelines might do it. And then we did kind of, in that scenario, as just an example where, well, it's manual therapy, but it's manual therapy not to the knee, but somewhere adjacent to the knee. So we could look at that. And so we did that in these courses. So we did that in terms of whether it adhered to clinical practice guidelines. And then we looked at systematic reviews of moderate quality to figure out if there was anything there that supported it.
So you looked at a bunch of different types of studies, musculoskeletal related, but was there a particular area that was most guilty of not being associated with clinical practice guidelines? My gut tells me it's probably manual therapy.
Yeah, we didn't, it's interesting because, I was thinking about this question a little bit. We didn't break it down, too much like that, although we did break it down by intervention. So interestingly, manual therapy and exercise are probably the two most common interventions that we do in physical therapy. In this review, they were the two most commonly taught. And so they kind of, if you look at the data, kind of represented where the data in general was. They're both about half the time they were supported by guidelines and about half the time they weren't. The things that were the least supported were modalities based courses, which kind of makes sense. 30% of the time they were supported by a guideline or systematic review. The ones that were the most reported were what we called soft skills courses. So things that went over communication, things like that, and education, patient education. So, and that was about, almost overwhelmingly supported by guidelines, which makes sense. My clinical kind of experience is that, PTs maybe don't sign up for those courses as much as they should. But those were by far the most supported, as 83%, and then modalities courses, like I said, about 30.
I thought your discussion was terrific. You tossed in some really great nuggets. One of them that you mentioned was that individuals actually receive more information from CEUs than they do from medical journals. And I've read publications where there's an increasing amount of individuals that are getting their evidence from things like social media versus actually going and reading a medical journal. Does that surprise you at all, or does it concern you?
Yeah, I think I'm not surprised. I think it's something we all need to meditate on a little bit, especially if you're a researcher. You can't really just present your research anymore, I think, if you want to have an impact in clinical practice. So I'm presenting research at the upcoming AM conference on how people with stenosis, when giving messages to kind of persuade them to attend physical therapy for spinal stenosis, were the least persuaded by research evidence. So we gave them a couple different statements, supporting physical therapy. The research one was, they were the least persuaded by that. So I think it might be something that's just kind of part of who we are as humans. So I think researchers in particular need to kind of move along with that and meet people where they are. So anyway, again, so that's part of it. We also need to kind of if this is where people are getting the majority of their information, I think, regulators and people that approve these courses really need to dial this in. We have this peer review process for journals, but there's nothing for these courses. And if that's how the majority of the physical therapists learn what they use in clinical practice, we need to tighten that up just a little bit.
Tell me, have you had an experience where you've taken a CEU course and the material that was being presented was completely outlandish, or you knew it was not supported by clinical practice guidelines? Do you have anything you can share on that?
Yeah, luckily, my background is maybe more rare in PT, where I jumped into a residency early on and then went into fellowship. And so by that time, I kind of had a good idea of the research. So I haven't taken too many courses that were like that. I've been in courses where, you'll have maybe a lab assistant take over for a little bit, and they'll say some things that you just know are not accurate. But it's not really the meat of the course. So yeah, I've been lucky to not see that, but obviously I've been in clinics, I've been in larger clinics early on in my career where we've hosted courses that I have not registered for, that I know are not supported well, or colleagues take, multiple levels of kinesiotape courses.
Yeah.
I'm talking to them like, what are you getting out of this, really? So
the fact that there are multiple levels is the shocking thing for me. I think you've been involved in some research regarding what websites claim as well. Can you talk a little bit about that?
Yeah, that was an interesting one. So we looked at the top 15 of the most highly trafficked websites on the internet, which is interesting because we are by no means the first people to look at the quality of information online. This research has pretty much been done since the existence of the internet. But no one has really looked at the most highly trafficked websites, which is where people are going. And so that's what we did. We did something similar to what we did with these CE courses, where we looked at the accuracy of information. And other people have done that as well. And our findings are pretty much in line with what people have shown. It's not high quality. I think if you talk to people, they kind of intuitively know that. But we looked at some other stuff as well that was interesting. We looked at authorship of the websites, so who's writing these papers, or in a lot of cases, editing the papers, and what does that mean? And then we also looked at the best practice guidelines for musculoskeletal care from a paper, a Lynn paper, I think it was in 2020 that came out in BJSM. So we kind of operationalized that a little bit. And so we found first on the authorship front that zero physical therapists, these were musculoskeletal websites, zero physical therapists wrote any of these or edited any of these websites rather. So, which is interesting because there's some research showing that our knowledge is on par with orthopedists. Orthopedists were the most common physician specialty, but if you looked across all of the web pages, there was more physician specialties in areas that probably wouldn't know much about musculoskeletal care that were editing the pages. So ophthalmologists, which I think if you've ever talked to an ophthalmologist, they probably know as much about back pain as like a layperson. It would be like an orthopedist reviewing a page on the eye. It just doesn't make a lot of sense. And so that happened. That was pretty eye-opening. And these editor roles that physicians took on actually were pretty nebulous. So it looked like, it appeared as if journalists wrote most of these pages. And then, it was kind of a placeholder that a physician kind of skimmed through it and checked it off, is probably what happened in reality. So that was what happened with the authorship front. As far as when we started to break into best practice guideline or best practice recommendations and what was recommended on the webpage, some things were just glaringly absent. They almost never mentioned psychosocial factors as something to consider, your mental health, etc. And rarely did they talk about the limitations of imaging. Some pages actually advocated getting imaging, so they maybe said things that were contrary to the evidence as far as that goes. And then the most glaringly absent was encouraging people to stay at work. And so I think maybe you can make an argument there's a reason that on a web page they wouldn't necessarily do that, but those were the three things that were almost never present on these websites that are recommended for musculoskeletal care.
Yeah, I've reviewed papers that have reviewed websites, and one of my earliest works over 20 years ago, I proudly say I had a paper rejected at JAMA where we submitted something similar, and there's almost a complete lack of validity in what's said and what the actual truth is with these. You also have a really nice viewpoint in JOSPT, which I had the privilege of actually being the editor of, and you created this wonderful infographic. Do you mind? That one almost broke Twitter. Everybody loved it. Do you mind talking to us a little bit about the origin of that? Who was, who authored that infographic, and tell us what your goal was behind it?
Yeah, I loved making that. That was me. That was my limited artistry skills drawing that. But it's based off of what I think is a Far Side cartoon where there's several physicians blindfolded looking at an elephant. And that was something I was, even though it's a Far Side cartoon, I remember being introduced to it by Barb Stevens in my fellowship program. And it, since then it's kind of stuck with me. So that's an adaptation of just this parable that's been, a common parable for, over 1,000 years, I think, about 6 blind men going into town, different variations on why they're brought into town, but they hear there's an elephant in town and they want to feel an elephant. They've never seen one, they've never felt one, they want to know what it's like. And as in some versions of this, the king positions them in different areas of the elephant and asks them to feel it and report back on what the elephant is. And so obviously the one at the head thinks an elephant's like a jar, the one at the tail thinks an elephant is like a rope, and they're so adamant about their limited perception that in some versions they get into a fist fight and the king falls over laughing. And it's a parable to kind of demonstrate that we really, each of us have a limited perspective, especially when it comes to complex or tricky problems. And we need to have some humility with that. And as it applies to physical therapy and this, cartoon really that we put in the paper, historically in physical therapy, we have these little camps, and you could spend your whole career just learning one approach or one way to look at a problem without taking a step back and maybe trying to look at the person as a whole. And so we get into these camps, as we said, and the reason it's related to CE is, you can have these individuals theoretically who could take a course that isn't supported by guidelines or reviews, and they could take those courses for their whole career. I mean, based on how common we found that those were. So unwarranted variability in physical therapy practice is a big problem. It's been recognized as a big problem for a while, and we think this is probably one reason for that.
Well, the thing I loved about the cartoon the most was the guy sitting in the chair, not touching the patient and just saying it's his brain, you fools, or something like that. I mean, it's just so apropos from what we see nowadays. Getting back to the PTJ paper, do you think you'll see a change do you think this will be an impetus of a change with CE approvals moving forward, or do you think there's such financial game to it that it's not likely to make a difference?
So in his 2006 Macmillan address, Stanley Paris pointed this out. I think just prior to that, they had switched to a state-by-state approval process, if I'm not mistaken, and warned that this is going to be a big source of revenue for states, and they are going to be motivated by competing interests to approve every person that applies. And unfortunately, I think he was right on the money. I just got back from the House of Delegates, and we made a motion for the American Physical Therapy Association in partnership with relevant stakeholders like the Federation of State Boards to just look at this, and maybe in the viewpoint we come up with a couple suggestions, but could they come up with at least maybe some recommendations that could be used across the board between states for reviewing and approving these courses. I respect highly the role and the effort that people have put forth on this, and in all of our work as an association. I will say that what I heard from the board on this issue wasn't the most promising, and the questions that some states asked kind of led me to believe that for some states, this might not be a road that they're willing to go down. What I would challenge, and what we try to do in this viewpoint, what I would challenge people, if a committee does get developed to look at this issue, is just challenge them to come up with some basic standard, even if, like we said, it's just badges, where we can just have badges indicating the level of evidence that's there for the course. Whether you want to have 5 levels of evidence, or whether you want to make it like the Olympics where you get a gold, silver, or bronze medal, who knows, but something where it's at least like a degree of informed consent for someone that signs up for these courses. As researchers, or probably the audience that watches this video or listens to this, you're going to be a person that has some knowledge of the research, most likely. Well, I would argue the majority of physical therapists might not. As we talked about, they get most of their understanding from continuing education courses. So if we could put something like that up front, it would at least, like I said, allow them to make an informed choice. And if they decided to take a course that wasn't backed up by the highest level of evidence, that's okay. That's a decision that they made, but it would be a way to kind of nudge them. And I think that would be something that's easy for states to implement. It wouldn't, disrupt the wheels in motion at this point. We'll see if that happens. We'll see.
Yeah, we'll see. I'm not super optimistic about it, but I appreciate you pushing that. Let me ask you something. Are you surprised at how positively the work has been received on Twitter? I mean, just 2-3 weeks ago, it was just lighting it up. I mean, does it make you feel pretty good to see your work out there like that?
Yeah. I mean, I think, like we talked about, it's not just as researchers now, your job begins after the paper is put out there. So I think it shows that there's something there, that people have noticed this problem. And so I think people are supportive of it. It makes me feel good, but I'm also, as you said, maybe not the most optimistic about what the outcome of this is going to be. And so that's great that Twitter had a fantastic response to it for a week or two. What I would love is to see this get to the finish line where this is actually implemented and changes are happening. So that would be something that I'm still kind of, going to encourage people to do. If you're listening to this and you have a role in a state association where you review these courses, that's something that you can change. So I hope that people not only just read the paper, but then start to look at in their roles, what could they do to change this?
Seth, thanks a lot for sharing your work with us. I know you're very active on Twitter. You may have other platforms. Do you mind sharing those for our listeners so that they can follow you?
Yeah, so I'm, outside of Twitter, I'm the owner of the Movement Brainery, which is a continuing education company. There's a free Facebook group that we have where we like to talk about clinical reasoning concepts. There's some patient cases and articles that we share in there. So you can find us there on Facebook. Instagram, we also have an account for the Movement Brainery. We have a mentorship starting up and some courses that would be highly supported by evidence. And so we're trying to do that and shift the focus a little bit into clinical reasoning and kind of some of those soft skills things.
Well, busy guy, best of luck on those efforts. And thanks again for helping us out on Shop Talk.
Appreciate it. Thanks, Chad.